everyone. Thank you for joining us here on Chai Time. I hope everyone had a great weekend. Hi, Olivia. How are you doing this morning?
Hello, Linen. I'm doing good.
I don't have to ask you how was your weekend because we
was
spent the
good.
weekend together.
I know. It was good. It was good. The weekend was fine. Sunday was amazing.
Yes, yes.
We had the hats and henna
Yes.
high tea event.
Yes, for the
and
rose.
For the rose, and it was
Yes.
amazing. Just didn't feel like I was in Houston. Felt like I'm in.
I know
I'm in
the
England.
beautiful
It was
hats.
beautiful.
That's Ashma.
That is Ashma.
That is Ashma.
The
It was a
beautiful
very,
hats,
very
yes.
nice event
Very,
and a very good cause as well.
Absolutely.
Yes.
Beautiful stories, right?
Of course.
Right,
yes.
right. And we saw Monalisa there.
Yes. we
In
saw
her pretty hat
Monalisa.
too.
And let's give a shout out to her for graduating.
Yes!
Congratulations.
Congratulations. She's Dr. Monalisa Chandra.
Awesome.
You've been busy.
Yeah, it was a busy weekend. Yes.
It was busy, and it was really nice though. It was nice to see you there.
I know, after a long time, right?
After
I
a
mean,
long time,
it
we
seems
ladies.
we are always in touch, but not really see each other as much.
Yeah, exactly. And I love the henna. So I got a one on my shoulder. It's covered, and my sister got it on her hand. It was nice.
It was fun.
It was fun.
It was fun. Variety kind of hats over there. Like while researching on that a little bit on what hat to buy, So again, like Kentucky Derby, regular English tea hat, and I was showing Gayatri, see, this is that.
Yes.
So the rose is for breast cancer awareness,
Yes.
correct? Okay.
It's basically a fundraiser for the Rose, they are the mammogram facility.
Oh, okay.
So, and this one of our friend, she does this every year.
Okay, awesome.
Yeah. It's nice. The sandwiches and everything was so yummy too. Anyways, so getting back to our show today, birth and new motherhood are amongst the most significant experiences in a person's life. It can be an incredible and joyful time, but for some moms, the experience brings with it mental health challenges. Here to help shed some light on such struggles and what can be done to help are my guests, Dr. Claire Crawford, a social worker and assistant professor of pediatrics in the Division of Pediatric Palliative Care at Baylor College of Medicine and Texas Children's Hospital, Dr. Sylvia Lawler, a mental health advocate, educator, and researcher, and Dr. Monalisa Chandra, a behavioral scientist currently serving a postdoctoral fellow at the Department of Epidemiology, University of Texas MD Anderson Cancer Center. Welcome, ladies. It is very nice of you all to come here this morning. And a topic that is so relevant, so important, so sensitive to many, many of us. So let's begin with your own journey into motherhood. Who's going to start?
Okay, well, I will.
All right.
I have an 8-year-old. She is amazing. I had her when I was kind of in the middle of my doctoral program.
Okay.
So that was a little bit difficult trying to navigate both motherhood and, my normal work and school and all of that. But somehow I've managed. And one of the things that I've always heard with new mothers is the days are long, but the years are short. And I totally understand that now. Monalisa?
Well, yeah, I had a very dramatic pregnancy, delivery, and everything. I have two wonderful boys, two children now. But I had 3 pregnancies, out of which I lost one, and that was very traumatic. And the second and the third pregnancy kind of went almost all right. But delivery was again traumatic. So, I mean, with all the 3 pregnancies and 2 deliveries, postpartum has been very interesting, and that sort of motivated me. My inquiry or my understanding about why maternal mental health is important, because I was going through hell at that time. So that drove me. That became my dissertation, and that became my dissertation, and that was an amazing journey to see that it was so much. It was just not about individual experience. It was a It was a culmination of what was going on around me, the healthcare system, the culture, the norms associated with maternal health, maternal mental health, so it was fascinating. I mean, as much as I'm blessed with two wonderful kids, I'm also blessed with this research experience, which has become a cause in my life. And I'm still continuing at MD Anderson. I'm working on pediatric cancer survivors and their pregnancy risk and both mental as well as physical. So, yeah.
All right.
I think many women will relate to me when I say that I've wanted to be a mom for a very long time, almost as long as I can remember. And I started planning to have kids in my 20s, but wanted to wait until I was finished with my doctoral program. So I did wait until 2020 when I finished, although then the pandemic started, so I delayed a little bit. My husband and I started trying to have kids a little over a year ago now, and I was always so scared of having fertility issues, so I was completely shocked and delighted when our very first try we got pregnant, just shy of my 30th birthday. That was the most joyful I've ever felt in my life, and I woke up every day so excited to be a mom. Even though I worked with, and I still work with, a lot of women who have lost pregnancies and lost children since I'm in a hospital setting, I just never thought it would happen to me. So I was completely shocked and devastated when 2 weeks after my positive pregnancy test, I started to bleed. And it was later confirmed that I had had a miscarriage. Because it was so early, there was no way to find out why it happened, but I felt like that day I changed as a person. I changed in the course of my whole life, and I started to view the world a little bit differently. A few months later, we were delighted to find that we were pregnant again, expecting a baby for the second time, and I was very nervous throughout that time because that joy I had had the first time around was then clouded by fear of what I knew could happen because it had already happened to me. So that time I was pregnant for longer, made it until 10 weeks, until I started to bleed again. And that time I found out that I had miscarried because of a genetic reason with my baby. And since that time, we have been trying to get pregnant again without success. So I celebrated Mother's Day. Happy Mother's Day to you two as well, because I know that I am a mom, but I also don't have a baby to hold in my arms yet. So as someone who works with people who have experienced loss, but also having experienced it myself, I feel so deeply for the many, many women who have also gone through this. And I hope that whatever I can offer as company, as support, will be helpful to those listening or watching.
You are strong, very strong, and we appreciate you coming here and sharing your story. So, we all have our own experiences, and as being mothers, and many times we don't realize the effect it has on our mental well-being. So that is the reason why we are all here today, to talk about it, and to let a lot of the women out there know that they are not alone. Whatever they're going through, each of your story is different. So it affects women differently. And that is what is firstly important, that we should be aware of that. So let's begin with what is maternal mental health?
Monalisa.
So, maternal mental health is defined by WHO as the mental ability or ability to function in normal day-to-day behavior during pregnancy, after pregnancy, and generally it is considered the first year post-pregnancy. So that's the time period her ability to cope with things and ability to function in the society. Obviously, that there's a very important reason behind it, because she has been creating a life inside her, and sort of the turmoil that went through biologically, psychologically, and that changes right after delivery, and then there's responsibility and hormonal disbalances. So that's how it became such an important. Maternal mental health has been under scan since late 1800s, but it's been recently. Lot of emphasis have come into it because of what we are seeing around in the whole country in terms of maternal mortality. Just to give you an idea, among all the developed nations, United States has the highest maternal mortality counts and as well as rate. And in Texas, which is a major problem right now, we have a significant high rate of maternal mortality. It's like 18.3 per 100,000 women. No women should die because of maternal reasons. And in Texas, in the first year of birth, first year postpartum, 86% of maternal deaths are responsible because of mental disorder in the first year of postpartum, which also includes a substance use disorder. So that's where these are all the data that I came across during my dissertation. And what was amazing to feel, it's a personal journey, but it's a journey for women who are not mother yet, who are planning to be mothers, who have lost children, and who are currently mothers. Because we all will, some way or the other, go through this experience, be with your own child or somebody else's child or some other friend or family around you. So, yeah.
Mm-hmm. So what are some of the signs and symptoms?
Of postpartum depression specifically?
Of maternal health, maternal mental health.
They're widely ranging.
Okay.
Based on the diagnosis and the period of time in which whatever mental health issue starts happening. But it also depends a lot on the woman, because every woman's experience is very different.
Okay.
One thing that's very, very common among mothers from preconception to postpartum is anxiety.
Right.
So it can be a very anxious process to start trying to get pregnant and wonder what's going to happen. You have all these unknowns to get pregnant, and then hope that everything goes well. Start wondering what's happening in your own body, how to control it. And then certainly once you have a baby, now what are you going to do with this new child that you are totally responsible for? So anxiety is a widely ranging symptom. Depression is also very common, particularly any type of perinatal, which just means around the time pre to post birth. Any perinatal depression is very common. What that may look like is more than what we think of as baby blues. I think
Correct.
A lot of people see baby blues and they think, well, it's fine, they'll get over it. And it's true that when a woman delivers a baby, her hormones completely change, and some of that may cause these baby blues symptoms, like feeling a bit tearful, sad, worried for a couple of weeks. But postpartum depression and anxiety look a bit different. They can persist a good bit longer, from a month to a year after birth. And that may look like not wanting to get out of bed in the morning, not enjoying their baby as much as they were assuming and hoping that they would, feeling less motivated to do those things that are really impactful and important to them typically, which may be work things, it may be fun things, but just not being as engaged as they wanted to be. And it may include having some issues with the relationships in their life. in very rare cases, I think many times when we hear postpartum depression, we think of what's actually postpartum psychosis. Mhm. And psychosis is quite different. That's an event in which a woman may actually start to see things that aren't there, may start to have intrusive thoughts about hurting themselves or their baby, which sounds impossible.
Right.
Because it's a biological process that takes over your mind if you're having postpartum psychosis. It's not a rational process that women think about at the time. It's something that's happening to them. But postpartum psychosis is relatively rare in comparison to postpartum anxiety and depression, which happens to about 1 in 5 women.
Okay.
So here I'd just like to give you an extent to understand. Like often when the major mental health block in our societies, whenever we hear about depression or anxiety, it's like something is severely wrong with her. She is, we have this taboo, right?
Correct.
I mean, it has been established in science and being told everywhere now, for a long time, that mental health is a disease. Mental health disorder is a disease. Same thing in during pregnancy. So the stages that she mentioned, postpartum blues is like, or baby blues as we call it, it's like 60 to 80% people, on our average 70% women after delivery experiences it. And it subsides over the time. So, and then comes the postpartum depression, anxiety stage. That too is like around, not much, 10 to 20%. That needs treatment if necessary. It needs counseling, talking to support from the family. The other kind of issues that happens, especially with women who lost their children, is the PTSD. And I was one of the victims of that because again, child conception, again, we always talk about maternal mental health is from pregnancy to delivery. I believe it should start even before.
Okay.
The whole idea of conceiving a child, as exciting it can be, if it's a planned pregnancy particularly, it can bring in a lot of anxiousness. For postpartum stress, PTSD that happens with the delivery or in the process of conception or in the whole experience of motherhood for first 1 year, that is also pretty low, but that can have a very long-term impact. So for me, I did not even realize that until 4th year of my firstborn. And I was carrying that from the first pregnancy child loss. And any kind of negative experience that you have during delivery, that stays within you. And I was like, for me personally, I thought I was strong enough to handle the typical mistake that every mom or every person having mental health issue deals with. I was like, I'm strong enough. I've done a lot in my life. I don't care. I pushed it under the rug for good time until postpartum blues hit. That is when everything, came out really bad.
Right.
So after 2 years of the first loss, when I conceived my second child, it was very traumatic, conception through delivery. And after that, I was like constant, this thing that she was talking about, this fear and anxiety, I was in constant state of that until almost 2 years. One time I realized that I can't handle it anymore. I was not interested in anything that I wanted. Everything. I was always anxious of the fact that I might lose him again. That was a terrible fear. I couldn't sleep. He would be sleeping in a cot. In the middle of the night, I'll go and check whether he's breathing or not. And that continued until almost 2 years of his life. So that's when the treatment and counseling and all those things started, and I'm glad I managed it.
Right. I think, for me, I had my kids in Canada, and when I had my first one, I still remember the doctor or the nurse from the hospital would call for at least the first week or two to find out how we are doing. Is the
Same
so that
in
was
Australia.
what I was, my question was, do we have the same here? Because the doctor, the nurse, I wouldn't say the doctor, but the nurse would call and say, is the baby able to latch onto your breast for breastfeeding? Are you getting enough sleep? Are you getting enough rest? I had, and I would give all the answers, and then they would also ask me to take the temperature. So there was all these follow-ups that I think really helped also. And in my case, I had my mom for the first one, so I was very blessed. And but I think that that kind of helps, especially being the first time being a mom. That and they always ask you, how are you feeling? So they basically want to know your emotions. What are you going through? And I remember with my first one, I had such a hard time breastfeeding. And I was getting so stressed. I could not sleep. And thankfully, my mom, she was like, Lynn, you just need to bottle feed him. Because then you are going to rest and he is going to sleep. Because for him, crying hours and hours is not helping anyone. And your stress level is going up way high.
Right.
And you just don't have any milk to provide him. He's hungry. And finally, I gave in because that guilt is like, I'm not breastfeeding him. It's supposed to be good for him. All the books I read and everything was just out of the window for me. And I'm like, okay, I finally gave in. And he had 4 ounces of milk and he slept for 5 hours.
Yeah.
So,
So when I delivered my daughter, I kind of experienced a lot of things. One of those issues was I had a C-section, and it was a very traumatic C-section. Sometime in the middle of it, they delivered her, and then all I heard was a slap, and then it's not going back. And then I just passed out. Well, I threw up, and then I passed out. What ended up happening was that my uterus didn't contract after birth. So they had to end up going in and they put a balloon in my uterus, and then they deflated it and then took it out. So I woke up without her, right? And I come from public health, and that's all we heard. Breast is best. Do that. And so in my mind, okay, I had done everything right in my pregnancy. I was diagnosed with preeclampsia there at the end. I did bed rest, like the C-section was scheduled, all of those things. And I failed, And so when I woke up, I had an immediate panic attack because this was not normal, right? This was not what I envisioned. And I thought I was going to die, like literally. I was like, I can't breathe. I don't know what's going on. Where's my daughter? And nobody was really paying attention to me because I guess I was like, what do they call it, triage? So I was in a triage with a bunch of other people, and one of the nurses just came up to me and she said, do you have anxiety? And I was like, I don't know. Just give me my kid. And so that was very traumatic. And yeah, it was hard to connect with her at that point because I didn't feel like we had that experience that we were supposed to have together.
Right.
And
I'm sorry.
QuadratMedicalBoardReview.com.
You're listening to the Chai Time Show on 99.5 FM.
Thank you for tuning in to Chai Time. For those who have just tuned in, the topic of discussion today is maternal mental health. We are also on Facebook Live, so check us out. It's been very interesting. We've all been sharing our stories out here. And I think the important thing here is we are sharing because we want you all to share. We want you all to be part of this topic of discussion. So if you all have anything to talk about, do pass your comments onto Facebook or give us a call. The studio line is open. It's 713-974-4000. All right, I'm sorry, Dr. Lawler.
That's okay.
I just kind of interrupted you earlier.
I have a little bit more to my story.
Yeah, definitely. Go right ahead.
So one of the things that I think is completely lacking in any type of maternal mental health conversation isn't just depression, it's also the other side, which is mania and or hypomania and just bipolar disorder in general. It's a condition that not a lot of people understand. It's highly stigmatized, but it does happen, and it's really hard to identify. So I have been living with bipolar depression for I don't know how long. I wasn't diagnosed until about 2 years after my daughter was born. And one of the things that made it apparent, well, one was I just kind of went a little bit crazy. But looking back, when I first had my daughter, I was a freaking rock star, and I was like, well, this is great. There's nothing wrong with me. I can sleep for 30 minutes and not have an issue. Of course, I was at home and I didn't really have a lot of other things to do, but I didn't realize at the time that what was actually what looked like successful parenting was actually just me running on mania. And I don't know what to say other than it happens, and just to be aware of it. There isn't research on it, but it is there, and I just want to put the word out. Just kind of look over bipolar disorder, and once you have a child, it makes it worse. You might have had it without realizing that you had it, and it's okay if you do, or you did, or anything like that. So that's it. That's the end of my story.
Yeah, I mean, it's quite normal with a major life event like this. A lot of undetected physiological as well as psychological things come up, right? So, and that's one of the things that we always advocate, that it is okay. It's okay to talk about it. It's okay to, the things that you need is to seek help from your doctor, seek help from your family. So you need to do what you need to do. So, and the thing that she also mentioned about this mania, I think to some extent, Lynn, it's also socially constructed. Because this society wants us to be the perfect mother, and now the definition of perfection is very subjective. Perfect mother when you're pregnant, or before pregnancy when you're trying to become pregnant, and then post-pregnancy when you're mother, early childhood, starting from breastfeeding to whether you're taking care of the kid or not. So it's a lot of social construction that puts a added stress, right? I mean, we have talked about it also before. So puts a added stress leading to this kind of anxiety or maniac behavior.
Right.
And I wanted to revisit a point you made, Lynn, about follow-up. Among women who give birth, but also women who lose a child, anyone who interfaces with the medical setting because of pregnancy or trying to conceive. When I had my second loss, I was really scared because I had not been through anything like this before. Actually, it wasn't termed this way until another woman who went through loss told me, but I had gone through labor in my home to give birth to this baby. Even though I was only 10 weeks old, I could hold my whole baby in the palm of my hand. But because I had decided in the hospital before I went home to go through with what's called expectant management. That's a natural miscarriage that is not aided by medicine or a surgery. I was really left alone. I didn't know that I would be going through labor. I didn't know how much bleeding was too much bleeding. I didn't know what to expect. And we don't have that same follow-up here of getting a call from a nurse or a doctor in a couple of days and saying, hey, how are you doing? What are things looking like for you? How's your baby, or how's your body? And that's something that I so wish that I had to make me feel secure in what I was going through. When all the rest of the world was crashing down around me, so it felt, I really needed medical support to tell me this is normal. What you're going through is okay. Yes, we will. I tried calling the office and saying, can I come in for an appointment? And they said, not unless you meet these criteria. And Monalisa was explaining to me that that is part of how the medical system works here. It's not because the doctors and nurses who took care of me didn't want to help or see me, but that's not part of the follow-up plan. So in their place, I had a lot of social support. I'm lucky to have nurses and doctors who I call friends, and I was able to call them and just talk through what was happening. And I think that for many of the listeners out there, we have to rely on the people in our networks. We have to be willing to say, hey, something happened to me. Even if you've had a healthy baby, to be able to say, I'm a little nervous right now. I'm going through something hard. And I could really use someone to listen or give me advice. Should I go to the emergency room? Should I find a therapist? Can we just talk for a few hours? That part of reaching out is something that I wish didn't fall on the responsibility of the woman herself, but in this country it really does.
Yeah, it's a lot because already, going through the experience and then having no support is a lot. Like you just feel kind of alone. But I think the thing is also that I know a lot has to change, and we really need to educate ourselves. We really need to know talk about our emotions, because many times so many things are taken so lightly. And we just shrug it, like you said, Monalisa, you just shrug it and we just say, okay, we'll get over it. But when? We need to know when or how and things like that. My question also was for fathers. Do fathers go through depression while, the wives, the moms are going through postpartum depression?
Absolutely, they do. Absolutely, they do. Around 4% of fathers go through depression in the first year of the childbirth, and that risk rate increases more if the father has a history of depression or anxiety disorder or family history, or financially in a difficult situation.
Okay.
So because this is the assumed norm in our society, father being the provider to the family, it kind of puts in that pressure on them. And it's also another cultural aspect that men are not it's not a normal thing for men to talk about their mental health, right? So as a result of which, women are more prone to depression or have depression number-wise, but we manage it better than men do. That's why the suicidal rates are higher.
Mm.
So yes, father, and I really wish if there were some father. I know my husband went through, if not depression, but he had to deal with me, and we came out of this together with 2 children with God's blessing. But it was hard time for him, and it's not easy for him to see me crying for hours, running out of the house, and it was. Now looking back, I can see what he went through. But at that time, I was not in my state of mind, right? So, but he was the fort for me. But I'm very sure there are many more fathers who can share their part of the story. Losing the child itself, even we say when we conceive, we are a mother, right? But for them, it's an indirect bonding through us. And once they hold the child, it's a different thing altogether. So it's hard. It's hard. And then relationships gets affected, as you said, with postpartum depression, and how to handle that. And these are things that you don't learn from books. Yes, awareness is important. That's why we need to talk and raise awareness. But it's just probably if mental health was not such a taboo in this country, people would have talked more and shared their experiences. But for men folks particularly, I feel there is so much block in terms of talking about this. Perinatal male mental health is something very, very minimally researched, as a matter of fact.
So as much as we are saying women need to come out and talk about it, men need to do the same.
Absolutely.
More so, because they tend to they tend to put everything inside them and bury it inside, which is not healthy as well. So in terms of awareness or access to resources, do you think there's a big gap amongst various cultures or ethnic groups?
Yes, I think, just not even thinking about ethnicity, it's just there's just a big gap in general, especially when there's a loss of a child or a pregnancy. Nobody really talks about it. There aren't a lot of support groups, and we are going to post a link of resources for people who are going through these things. But it's just not there. Unless you have your own therapist and you've had that relationship for a while, it's really hard when you're in the midst of grief to go look for somebody. And then finding somebody who specializes in it, and then finding the right therapist. I mean, it's a very long process, and it is a lot of responsibility to be put on somebody who is grieving, or who is stressed, or who is manic. So yeah, culturally too, yes. In the Latino culture, a lot of people tend to say, like, men are supposed to be strong, and there's this idea, it's controversial, but of Marianismo? No, well, there's that, but then there's also, like, the woman is supposed to be, like, very, well, like Mother Mary kind of thing, like Mother Teresa, like, and the men are supposed to be very masculine and take care of everything. So they tend to push their feelings aside. Now, whether or not that's true anymore, I'm sure in some regions, yes. But I think as Mexican Americans, or just Latinos in general, become more acculturated, that's a little less likely to happen. But that kind of stereotype is still there. Do you want to speak about this?
Oh yeah. So in South Asian communities, definitely let me know if I'm running.
Yeah, no, you got it.
So South Asian community particularly, it's Asia per se. There is. There are taboos and there are a lot of stigmas, which is kind of prevalent in all communities too. But here, the responsibility of a mother precedes everything else. But having said that, also sometimes the support system we get from our parents is also higher. Often they will stay right after the birth and help us with the delivery and all the taking care of the child. But it's all about what I'm trying to emphasize over here. It's all about the child's well-being, and the mother becomes invisible.
Right.
So that invisibility is the problem, because it is not detrimental to the child's health. It is detrimental to the entire family. And it has a transgenerational impact. So therefore, it is important that what the mother is going through, or even the father is going through at that time period, it has to be understood and listened to. What Claire mentioned, that somebody listening, it doesn't always have to be even a specialist. Somebody lending that hand and listening makes so much difference. It kind of empowers you to go back and work on it. And obviously you need a specialist to do the therapies and things that you need to do. But
I have a quick question on that. So you were talking about how the mothers usually, the grandmothers usually come in and help. Do you think there's a feeling of, well, I went through it and I was fine, so you should be fine too?
That's what I'm saying, invisible.
Yeah.
The mother becomes invisible. It's all about that. It will be fine, it happens, you'll just get over it, and so you can work around it, that's fine. But there are situations when you really cannot work around. You need help. You can see there are certain symptoms, or something is not right, not the way she used to be before. Some basic certain things, if you're tuned with the person, you will identify, right? And we obviously in South Asian community, we get immense support from the parents and the extended neighborhood and all that. But invisibility of the woman over here, or the mother, or even the father, becomes such a big deal that nobody. Even if one of the interesting things in my experience is when you lose a child. So I lost my first pregnancy at 7th month of pregnancy. So I went through the whole gamut of delivery in the hospital, normal delivery, pain and everything else, knowing I have to deliver this baby. I know this child will never be there. So and my husband, who was not with me at that time, he couldn't be with me at that time. He was going through extreme stress at that time. But it seems that when you go through a pregnancy loss also, there's a lot of stigma and blame games.
Yes.
Right? So those things cause a lot of trouble. So again, the focus is on the child's being there or not. What is going on with the parents is never talked about or never understood. So it's very easy to transfer your sense of grief to somebody else, blaming that person or whatever, So it's a societal way of looking at pregnancy, and undermining the existence of the parents in the process is something that needs to be actually thought about. I mean, definitely the child is important. That's the whole purpose, right?
Yes.
But for a healthier family, for a healthier life, for everybody, mental health of all the family members, especially the parents, is very important.
Okay.
And I wanted to talk about what support looks like for just a minute, because Sylvia, you brought up this great point about getting, if you can get your own therapist, that's wonderful. And insurance coverage for therapy in the United States is pretty abysmal. If you are a woman in Texas and you have Medicaid because of your pregnancy, you can have Texas Healthy Women Plus, which does entitle you to some postpartum depression mental health care. It's usually, if you're able to score positive for the Edinburgh Postnatal Depression Scale and get an official diagnosis, then you are entitled to either a psychiatry visit or, I believe, 3 talk therapy visits. I'm really glad that we have that, but when you're talking about mental health, you need therapy for way longer than 3 visits, which is 3 hours. And we have some fabulous therapists in the Houston area who do take insurance. There's still a copay, and we have a lot of therapists who don't take insurance, and self-pay for a therapy session is usually between $130 and $200, at least in the Houston area. The reason I'm bringing this up is that a lot of times, especially in cultures where there's a lot of stigma against mental health care and there is a lot of closeness within the community, we do rely on one another more so than any official or formal source of support. And so when you were talking about your loss, Monalisa, and how there's this blame, one thing I want to impress upon anyone who's listening is you will probably know someone who has a loss.
Yes.
Because 1 in 4 pregnancies end in a loss. I don't say that to scare you. I say that to normalize it. And it's okay to ask about it. If someone has had a loss of a baby at 7 months or at 7 weeks, it's okay to say, I've been thinking about you. I want you to know that you're a great mom. And is there anything I can do? Can I bring you dinner? Can I just listen with you? Can I sit there with you for a little bit? There are so many ways to make a woman feel more whole again, and it doesn't have to be a licensed professional.
That's perfectly said. There's many times when we want to support someone, we have those intentions, but we are overthinking so much of, am I going to say the right thing? Am I going to do the right thing? And then we are afraid to not hurt the person who is already hurting, that we tend not to take that step, which is, I think, one of the worst things we could do.
Yeah, I mean, it again, as you know, in the cancer area too, it's similar, that fear associated. It's kind of a deep-seated mindset or psychosocial factors, even in the general population, that, as she said, when you lose pregnancy, it happens. 1 out of 4 women lose pregnancy. So nothing to be so trying to be perfect in how you should interact with the other person.
Yeah.
So, yeah, I mean, that's very important, that normal conversation. And I think another thing which I find, as much as the women wants to get back being pregnant again, it's a self-driven thing, but it's also the societal pressure at times comes, especially with conservative cultures.
Correct.
So that why what's not happening, etc., etc. So that can be added pressure as well.
Okay. Well, we don't have much time, and
Well, I was just gonna. One of our Chai Time listeners, viewers, has a question. Rajni.
Yeah, sure. Okay.
She mentioned, or she wrote, how much role do the OB/GYNs in the hospital play a role in educating the expecting women about the possible depression postpartum?
So depression screening, it's been 2016. It has been enforced that you have to do a depression screening right away in the first intake but until and unless the physician suspects something unusual, they will not follow up on that. So ideally, if there is no visible symptom, there is no education per se, other than general things that these are to expect and these are going to be your tests. And but if other than the EMT how it's coded,
Right.
it's not a part of the package.
Add to that. I got to be a social worker in a women's hospital for a couple of years, which I loved. And my job was actually educating on postpartum depression once a mother delivered. Yeah. So the people I would go see were women who had a history of anxiety, a history of depression, or some other diagnosed mental illness. So only those women got the education. But it was really effective. A lot of them would be like, I would spend 5 minutes talking to them and saying, here are the symptoms, here's what to look for, here's a pamphlet. And many of them would say, I never knew about this. Or, you know what, I had that with my last kid and I never knew it until right now. So it's very effective when we're able to get social workers, child life specialists, anyone who is hired for the specific purpose of education. It's incredibly effective at education, awareness, and actually prevention, so that people know exactly who to reach out to for help before it ever happens.
Yep. Mm-hmm. So that's another thing I found in my research that one aspect of my research was to interview the healthcare providers and understand their challenges in obstetric and gynecological services. And what they often mention that only in the big hospitals or big clinics they have this social worker support, because within 15 minutes of their diagnosis time, it is not possible for them to do everything, correct? Right. And it takes a while to develop that relationship with the patient and all that. So having the social worker service makes a lot of difference right in the postpartum phase.
So one last question. I have so many questions, I was not able to squeeze them in. So we'll have to get you ladies back here again. So my question is, how do we as women advocate for ourselves and others? And how can we as a society kind of impact that where we have more prevention?
Well, it is a big question, and I think the first step starts over here, right in the studio, right? Engage in the discussion, talk about your problems, and in your kitties, in your kitchen discussion, in your work setups, and also I would. It's an interesting time in history right now. I would expect the society to be a little more understanding of what mothers go through or women go through associated with pregnancy. So a more compassionate approach towards women's mental physical health. So, and that is only possible through discussion.
Correct.
Right? I mean, at any platform possible. Like three of us, we are behavioral scientists by training, went through similar experiences. We came out, we wanted to talk about so that others who have been through this experience can feel, hey, this is normal. I mean, this is okay. So let's talk about it. Let's be each other's support system, and everywhere anybody wants to reach out to us, please do, and we'll be happy to help in any form of information that we can provide. And I would encourage this kind of discussion everywhere at every platform possible.
Yeah, they say advocacy begins at home.
Absolutely.
Yes.
And also within your friends and your closest social circle. And, then it spreads out to things like this. But definitely, like Claire was saying, there are ways to reach out. There are ways to be supportive with the people who are in your lives on a day-to-day basis. So.
And the thing that I would add is, you know your body. No one else can possibly know your body the way you do. You do not have to be a doctor. You do not have to be a nurse. If something feels wrong, talk to someone about it, whether it's emotionally or physically. You are entitled and you have the right to call your doctor, call your nurse, call anyone, your therapist, to try to get help. You do not have to go through something alone. And if you do have to keep pushing for it and saying, listen, you need to give me attention right now, that's all right. You are a woman, so I promise you're strong enough to advocate for yourself.
That was awesome remark to end it. Good one. Thank you, ladies, so much for your time, for coming here this morning. I think we needed more than an hour to cover a whole lot more, but I really appreciate each one of you, and thank you for all the work that you're doing, and good luck to everything. Thank you, Monalisa, for bringing this topic to light, for your ideas, and every time you come here, it's always an eye opener for us Chai Time girls.
And
Thank you.
thank you for creating a platform.
Yes,
for this
absolutely. And
discussion.
that's the
Yeah.
best part of what Lynn brings to the community is to bringing up this issue which needs to be talked about and very always shrugged under the rug.
We
and
try and
thank
be
you for doing
bold.
that.